Michael, thank you. Today, we are looking at women's health, a top concern for so many of us, especially women with cancer. This morning, we are joined by Dr. Simeon Jaggernauth. Thank you for coming in. And you are a doctor with the Cancer Treatment Centers of America.
Yes.
So let's start with the main cancers, and there are so many that affect women.
Yes, there are quite a few cancers, and when we look at cancer, we look at the prevalence of cancer in women, and you tend to see more breast cancer, lung cancer, colon cancer, ovarian cancer, and so on. But what takes the lives of many women would be things like lung cancer rather than breast cancer itself. When you look for signs and symptoms of cancer, there are several things that you can see. Such as in breast cancer, you may find a lump, something which is unusual, nipple discharge, bloody discharge, or some abnormal finding in your body which may or may not be felt by yourself or by the physician.
Let's go ahead and dive a little bit deeper into breast cancer. It's so scary because by now, unfortunately, every person probably knows somebody affected by breast cancer, whether it's a friend or a family member or a friend of a family member. And the thing I guess that strikes me so much is how young a woman can be that gets this. I mean, I've known of an 18-year-old that has gotten breast cancer. You normally think it's of older women. So many people in their 30s are now diagnosed with breast cancer.
Yes, we don't understand why more young women are developing cancer, but we do see that the general tendency is for women in their postmenopausal age who tend to develop this. But the incidence is there. There is a significant degree of population that actually has breast cancer at an earlier age. However, the majority of patients do have cancer that shows up at a later age, but with appropriate screening, this can be found early enough and treated appropriately.
When should you get a mammogram?
Usually, the current recommendation is for at the age of 40, or if you have high-risk features in your family, such as mutations, such as a BRCA mutation, BRCA1, BRCA2, or if there's a strong family history or a high degree of suspicion, such as an abnormal physical finding or an abnormal test of some sort.
Okay, let's go ahead and talk about ovarian cancers. What are the symptoms?
Usually, the symptoms are very vague. It can range from anything from abdominal pain, discomfort, lower back pain, change in your bowel habits, and even changes in your menstruation cycles, or as well as your sexual habits. You may have pain on intercourse, or even several things such as bowel movements that change to very irregular forms. So the symptoms are very nonspecific. However, you should visit with your gynecologist and have the appropriate exams for screening purposes.
How often? I mean, if you're ever getting any of these symptoms, because you don't want to be, overly cautious, and every time anything goes wrong, head over to the doctor, or do you?
Well, the main thing is that appropriate screening is the best way to prevent cancer. And if you have any type of symptoms that actually makes you very concerned, or you have a strong family history, then you should be a little more sensitive than most others. You're right, these symptoms are very nonspecific in nature, but with the guidance of your physician, you can find these cancers early enough, hopefully, to take care of them.
Besides screening, is there anything else that women can do to prevent any type of cancers? Eat healthy, exercise?
You know, for breast cancer, there are several studies that have been performed showing that reduction of alcohol intake to less than 2 drinks a day, in fact, even elimination of alcohol may be the best modality for reduction as well. There are chemoprevention agents that are available for women who are high risk, such as tamoxifen and Avista. There are also other modalities such as exercise, reduction of weight, reduction of your weight, as well as maintaining a healthy lifestyle may be extremely beneficial. Smoking is still an iffy issue, but when you think of the risks of reduction in cervical cancer as well as lung cancer, which more women die from lung cancer than breast cancer, then absolutely smoking will be very beneficial as well, reducing your smoking habits.
Such a scary topic to tackle, but one that needs to stay in the forefront
Absolutely.
For all women's health. Dr. Simeon Jaggernauth, thank you so much for coming in this morning. We appreciate it.
Thank you for having me.
For more information on the cancers that affect women, head over to our website, fox23.com. Click on the Fox box. Now, coming up at 8:15 this morning, we talked to 2 doctors about the leading cause of death in women. That is heart disease, what you can do to prevent it. So we hope you stick around for that. Get those dialing fingers ready. It is time for the Fox 23 News This Morning contest giveaway. And we are giving away a Red Cross first aid kit. If you're 18 or older, be the 23rd caller on our contest line. The number is 622-6676. Winners in the last 30 days, members of their household, and Newport Television employees and family cannot win the prize. Time check for you, 7:47 on this Friday morning. Reminders coming up in a couple of minutes. XM Sirius, feeling the crunch. We're going to tell you the new partner they're teaming up with in hopes of saving satellite radio.